Hello, good afternoon, everyone. My name is Sherifat. I'm one of the Band 7 physiotherapists from Long COVID therapy team. We cover Newham and Tower Hamlet. I'm here presenting with my senior colleague, Melissa Sandra. She's the Band 8 team lead for both pulmonary rehab and Long COVID teams. So today we're going to be presenting about Long COVID respiratory change. So the first question is Long COVID still around? There are an estimated prevalence of 1.9 million in the UK. So 1.5 million people, that is about 75%, is reported day to day to have reduction activity. The activity are actually affected by long COVID, and 381,000, which is about 20% of such people, reported limited a lot in their activity of daily living. First, suspected is when any patient come in with probably history of COVID and they've got persistent symptoms that is lasted more than 12 weeks or 12 weeks and above after they've been diagnosed and treated for COVID, then we will refer such symptoms as long COVID. So they can have a formal diagnosis of long COVID, and that is about 83,000 people, which is about 44% report history of long COVID diagnosis at 12 weeks. And after 1 year, some people are still having the same symptoms, and the percentage of people is about 69%, which is 1.7 million people. And there's 41%, which is 762,000 people still report history of long COVID after 2 years post-COVID diagnosis. Out of all these patients that are coming to the clinic with long COVID or diagnosed with long COVID, statistics has shown that 33% of these people come up with a complaint of respiratory symptoms, which they describe as breathlessness. So you can see the data is from the National Office of Statistics 2022. So what is breathlessness? Patients define it in different ways. Some patients will say short of breath, known medically as a dyspnea. It's often described as intense tightness in the chest. Some patients will describe it as hair hunger, difficulty breathing, breathlessness, or feeling of suffocation. So all this still comes under the same umbrella. Then now we're going to look of causes of breathlessness. There are so many reasons why people complain of breathlessness. So one of the major reasons could be related to lung conditions, cardiac condition, and neurological condition. So that is the reason in most cases when patients go to see their GP and they feel like, I feel breathless, the first thing the GP are going to think about is, okay, we're going to, after taking their vital signs, they're going to check a chest x-ray. So when they check the x-ray to rule out any lung related issue, then if they see if there's any reason for them to think that it may be cardiac related, then they will do probably ECG or 24-hour step to rule out anything cardiac. And if they think it's neurological, they do further investigation. After they've done all this investigation and they've ruled out this, then they can before diagnosis long COVID, because they will have ruled out all this lung or cardiac or neurological related condition. When this is being ruled out, then they will refer to long COVID. And this is the reason before we get any referral to long COVID. So we will ask the GP to have completed the chest x-ray to and do the full blood count, or maybe cardiac or ECG, or just to make sure that a patient has been ruled out of all these other related conditions before they come into our clinic. And another cause of breathlessness is mental health, like anxiety, stress, depression. All this present sometimes with breathlessness as well. And anemia, that is low oxygen level. Fatigue usually worsen breathlessness as opposed to causing breathlessness. Then we have abnormal breathing pattern. So effect of breathlessness. So this diagram, this picture is just to show the effect that breathlessness can have on our daily activities, on our day-to-day activities, and how this can make us feel. So normally it can reduce your people complain of difficulty going outdoor, unable to go shopping, unable to go to work, feeling fatigue all the time, wanting to sleep all the time. Some of them that can't do their shopping. Even eating can be a problem for some people, studying and everything. This is just a picture to show that our basic normal daily activities and how this will be affected by breathlessness, in addition to other conditions. So for the sake of this presentation, because we're talking about breathlessness as it relates to long COVID, majority of patients that come into our clinic diagnosed with long COVID, their breathlessness in most cases is related to breathing pattern disorder, as it's mainly the causes of breathlessness in long COVID. So now we're going to test our breathing, because first, it's quite unfortunate we haven't got enough people here, but I would love each and every one of us to try and test our breathing, because sometimes there are quite a few people that came into the clinic for long COVID, but they've never been diagnosed with long COVID. But after all this X-ray, cardiac, everything were ruled out, they were only referred to long COVID clinic because all the symptoms presented symptoms is in relation to long COVID, but there was no, and they did mention that they've never been diagnosed with long COVID. And this is because sometimes we do know that some people had COVID, but they've never been diagnosed. Some people only had a positive test because maybe one of the relatives in the property in their house had a long COVID infection, and they asked everyone to get the test. Even though some people never get a positive test for COVID, some of them still end up with long COVID symptoms, because I've got few patients that came in with long COVID symptoms but never had any positive test for COVID infection. So I would say let us all try and test our breathing. So because I've done this presentation before, and some people came back to me as professionals to say, I didn't have COVID, I was never diagnosed with COVID, but all these symptoms, when we tried this test, I was positive for some of these tests. And please, so let us try and do this test together. The first one is, when sitting, resting, do you breathe through your nose or your mouth? Try and sit down comfortably and try and check your breathing. Try and notice how you're breathing. Are you breathing in and out through your nose, or are you using your mouth? Try and note that as we run through this question. And at the end, my colleague, we're going to go over normal breathing. Then you'll be able to know if what you are doing is kind of correct breathing, if you're using the correct pattern of breathing or not. So the second question is, can you hear your breathing? So for few seconds, just let us try and sit back. Let us relax. Maybe for 10 seconds, try and listen to yourself breathing and say, I'm going to give you 10 seconds to listen to your breathing. As you breathe in and you breathe out, can you hear your breathing? So I would like you to try and note that down. If you are a yes and a no, so I will love you to try and note down your answers for each of these questions as we go through them. The third one is going to be, how many breaths do you take in 1 minute? So let us try and sit back. If you have your phone, you can set your phone to 1 minute. Or I'm going to set the phone to 1 minute, and I'm going to ask each and every one of us to try to breathe in and out for 1 minute and count your breath. So I'm going to say 1, 2, and 3, and I'm going to time it. Once I say it's 1 minute, then you can stop and try and note down how many breaths you take in that 1 minute. So get comfortable. We're going to start now. 1, 2, 3, start. When it's 1 minute, I'm going to stop. Stop is 1 minute now. So try and note down how many breaths did you take? So is it between 8 and 12? Is it between 13 and 16? Or 17 plus? So note it down as we go to the next slide. So Now, place one hand on your tummy and one hand on your chest, and try and breathe normally, the way you normally breathe, and feel it. Does your tummy expand when you breathe in? Note your answer. Is it a yes or a no? Try and check it and note your answer if it's a yes for your body or your tummy expanding, or a no. And the second option is, does your upper chest move when you breathe in? Note your answer if it's a yes or a no. The fifth one is time how long you can hold your breath for. So we're going to try and hold our breath now. We've done with the fourth question. So note down your answer if what part of your body is moving as you breathe in and out. Is it your chest or your belly or your tummy? Note it down. Then we're going to the next one. We're going to try and hold our breath. So you can decide, breathe in, and at the end of your inspiration, before you breathe out, you hold your breath. So you can decide to do in, or you can decide to hold it at the end of your inspiration or at the end of your expiration. Decide which one you feel more comfortable. And we're going to try to do that for 30 seconds. So try to check the timing on your phone or on your wherever. Try to time yourself to see how long you're able to hold your breath for. Hold it either at the end of your inspiration before you breathe out, or at the end of your expiration just before you breathe in. So I'm going to monitor the time for 30 seconds here. And once it's 30 seconds, I'm going to stop. And you're going to note down when you stop, how long, if you've been able to hold it for 30 seconds or less. So the time is going to start when I say 1, 2, 3, I will say hold, okay? 1, 2, 3, hold your breath. Stop. So thank you. This is the end of the question. I would like each and every one of us to note down our answers, as Mel, my colleague, is going to continue with the explanation, and she will give you explain more about our breathing technique, what is efficient, what is normal breathing, and how it can affect us. Over to you, Mel.
Seraphat. Hi, everybody. I'm Mel. As Seraphat said, I'm the lead for the long COVID and the pulmonary rehab services. So I'm just going to continue the presentation until the end now. So Seraphat has kindly showed us a demonstration of how breathing should look like. So I'm just going to explain a little bit more in depth how it actually works with our body as well. So if we move on to the next slide, sorry. So breathing occurs when we start by inhaling through our nose, and the air travels down to our lungs, to the alveoli, and there in the alveoli there's a greater concentrations in the alveoli compared to the capillaries that surround the alveoli. The oxygen then cross the capillaries. In contrast, carbon dioxide is concentrated in the capillaries and therefore then diffuses to the alveoli to then be expelled out of the body. This same type of gas exchange also occurs between body and the blood cells to maintain homeostasis. But all of that does not require any thought, because it's controlled by the autonomic nervous, also called the involuntary nervous system. So in that system, we have the parasympathetic system and the sympathetic system. So the parasympathetic system slows your breathing rate. It causes the bronchial tubes to narrow and the pulmonary blood vessels to widen, whereas the sympathetic system does the opposite. It increases your breathing rate and it makes your bronchial tubes widen and the pulmonary blood vessels narrow. Your breathing will change depending on how active you are and the condition of the air around you. So for example, you would need to breathe more often when you do physical activity, and then there are times that you can control your breathing and your breathing patterns, such as when you hold your breath or when you're singing quite badly in the shower, for instance. But to help to adjust your breathing to these changing needs, your body has sensors that send signals to your breathing centers, which is located in your brain. Okay, so it's in this picture here on the slide. So there's sensors in the airways which detect lung irritants, and the sense can trigger sneezing or coughing. Then you've got sensors in the brain, and they're the blood vessels which detect the carbon dioxide levels and the oxygen levels in your blood. Then you've got sensors in your joints and in your muscles which detect the movements of your arms and your legs. And these sensors play a role in increasing your breathing rate when you are physically active. So if we move on to the next slide, so that's how we breathe. And we've just gone through about testing your breathing and how it should feel like. But some of our patients, when they develop an infection like COVID-19, their breathing pattern changes. The rate and the depth of their breathing changes because it's needed to help to fight the infection that they initially contracted. And this response is essential as their body is under a lot of stress, and it's part of the fight and flight response. So during the acute phases of the severe infection, the breathing pattern will change to make sure the body gets all of the oxygen that it needs. So what will commonly happen is their breathing will become faster, deeper than normal, and they may breathe in and out of their mouth instead as opposed to their nose. But as the infection improves and the lungs start to recover, the patient's breathing should return to normal. But what's been happening is that in some cases it hasn't been returning to normal, and they're finding it difficult to switch off that fight or flight response, and it can be quite challenging. So then the breathing pattern then becomes habitual, leaving them in a fast, erratic breathing pattern, which then can result in them feeling very fatigued and breathless and slowing down the body's ability to recover. But long COVID is very complex, and so is breathing pattern in general. That's not necessarily associated with long COVID. So while the infection can cause a change in pattern, it's not always the case for changes in breathing pattern. There could be other reasons as to why there'll be changes, like as psychological reasons, so anxiety, stress, panic, and then there might be a biomechanical issue like postural issues, chronic mouth breathing, some pain as well, some musculoskeletal problems. And then you've got the physiological reasons why there could be a change in breathing patterns, such as asthma, exaggerated response to carbon dioxide, caffeine, etc. But if we move on to the next slide, so resetting the breathing pattern back to normal can take time, concentration, and it requires the patient to become aware of their breathing, which is why Seraphat done that little task with you guys earlier on. And when they start becoming aware, then they should result in feeling better. But the effects of having an abnormal breathing pattern can include feeling breathless at rest, moving around, or when talking, fatigue and low energy levels, tense muscles or twitchy muscles, unable to exercise, the brain fog, the tingling sensations in their hands, feet, or even the tip of their nose, headache. And if they're suffering with a lot of mental health issues as well, such as anxiety, that can all just add to that and worse. So these symptoms will continue to make them feel unwell, and it can be quite worrying. And a few people who have had COVID-19 have developed long-term effects in their lungs and heart. So I'm not saying that, it's just a habitual effect. It can be other causes. But even if this is the case, ensuring that they are breathing properly will not always make that change, and will make that change and can relieve the symptoms. But it's important to note that sometimes medical input is needed, and you may get some letters from us saying that, oh, we need you to do further investigations to establish the cause of the breathlessness, that it might not necessarily be because it's altered, it is habitual. And that would be required as a priority for actually treat the breathing pattern disorder. So if we move on to the next slide. So there's different managements of breathlessness and the respiratory changes in long COVID. So we've got breathing techniques, so depending on what the issues are, if it's breathing pattern disorder, that might be simple nose breathing exercises. If it's just shortness of breath on exertion, that might be deep breathing exercises. If they aren't suffering with long-term fatigue, you might consider some exercise as well, different positions to manage that breathlessness, whether that's leaning forward, in sitting, standing, and then therapy as well as the last one for emotional well-being, because as we said, having anxiety can cause a detrimental effect and can cause breathlessness to be worse as well. So that's quite an important one. So very holistic approach as opposed to one thing at a time. Okay, if we move on to the next slide. So this is just really a treatment summary that we just wanted to show you guys in terms of breathing pattern disorder in general. So it's just how it helps us to identify what is the root cause and what is the treatment options that we might consider, whether that is, if it's pain, then pain management, if it's breathing techniques, whether that is chest x-rays, spirometry, lung function to see what's happening, to investigate further, whether that's inhalers. So there's a variety of different treatment options, a little bit small, but we just thought we'll just add that as a treatment summary. Okay, if we move on to the next slide. Okay, and we just wanted to play this video, which is really great. It's a professional video for long COVID and how each of the symptoms can affect and how it can make it easier for you guys to refer into us. So if we just play that video.
Worldwide, over 250 million people currently have post-COVID syndrome or long COVID, and there's still considerable uncertainty about their long-term outcome. Long COVID affects all kinds of people across all social and economic demographics, so it's vital that we reach out, make ourselves approachable, and identify and investigate as many cases as possible. It's also a complex multi-condition, and presentation varies considerably from person to person. You will have heard about changes to taste and smell, but the most common symptom is chronic fatigue, feeling less able to do things, and needing to sleep during the day. Patients might report breathing or a tight chest, sometimes after very mild exercise, like climbing stairs, walking, doing housework, or even talking on the phone. Another common symptom is cognitive impairment, often called brain fog. This may describe loss of concentration, forgetfulness, and confusion. Some also talk about increased anxiety, irritability, or low mood without an obvious cause. They may present with dizziness, worsening fibromyalgia, new aches and pain, wheezing, palpitations, night sweats, a high temperature, or GI disturbance. Right now, we should consider that any chronic or remitting symptoms that appear after COVID without an obvious cause could be due to long COVID. While we have limited experience and history of long COVID, there are funded specialist services and help, even where symptoms are mild. In order for patients to receive the right care at the right time, it's important for us to use the correct referral form and to complete the proper investigations in advance. Without our guidance and support, patients may self-investigate and self-treat in any number of ways. So it's vital that we make them aware of the support that's available and help them manage their long COVID symptoms. To find out more about what we can do to help patients with long COVID, now and in the future, visit www.nwlondicb.nhs.uk and follow the link to the post-COVID syndrome service.
Thank you. That was particular to NWL, but they were kind enough to share this and allow us to use it as well across all long COVID services. So move on to the next slide. So has anyone got any questions and answers before we pass on to Patrick? No questions. Okay, lovely. Thank you so much for listening to me and Seraphat. We'll just pass on to Patrick, who'll be doing the next part.
Thank you very much. Have I got control of the slides or?
I do, Patrick. If you wanted to share your own, you're more than welcome to, if you'd prefer to.
No, it's okay. If you've got control, I'll let you control. If I ask you to move ahead, please.
Yeah.
That's okay. Great. So I just want to tell you a little bit about me first. So my name's Patrick. I'm a physiotherapist in the NEL long COVID team covering Barking, Havering and Redbridge area. Prior to coming into long COVID, I spent quite a long time working in acute care, primarily in critical care, so ITU, HDU, and I also had some experience in acute wards such as cardiothoracics, a little bit of cardiac and pulmonary rehab as well, and elderly rehab. So I felt that I had a good understanding of respiratory management as well as rehabilitation. However, now I work a lot from home. I do see patients in clinic as well and in their own home as well, but predominantly from home. And my understanding of managing respiratory condition when I came to the team was inadequate, and it was a steep learning curve. So I just want to share some of my learning with you. Next slide, please. So just a little bit about our service, first of all. We are lucky enough to be a consultant-led service. So we get our referrals from the GP, our consultant, Dr. Ainley, triages the referrals. Some patients go to clinic and get further medical investigations and screening, and others come directly to therapy. All patients will eventually come through to therapies. And in therapies, we have a multidisciplinary team, including physios, OTs, nurses. We have psychology in our team, and we have some assistants in our team as well. And after our program, generally lasting for about 10 weeks, although some patients may stay a little bit longer with us, we then discharge our clients into the community with further help and support, so that they do get ongoing help and support, because we do know that many patients who come through our service may not make a full recovery while they're in with our service, and indeed many patients may not start their journey of recovery until they've left our service. Recovering from long COVID can take quite a long time, so we want to make sure that our patients do get ongoing support. Next slide, please. Just going back to our medical investigations. So when patients come to clinic, they do get screened by our consultant. And what he does is check for red flags. And as Melissa and Sarafat mentioned earlier, it's to identify or to rule out any other causes of the symptoms that they're experiencing. So our consultant may request a number of different investigations, including physical examination, ECG tests, cardiac echoes, chest x-rays, CT scans, spirometry, further blood tests, sleep studies, and a number of other tests as well, including referrals to specialists such as neurology, to chronic pain, to rheumatology, for example, just to make sure that there isn't any underlying cause for the symptoms that the clients are experiencing. In addition to ruling out other conditions, our consultant will also help our clients to optimize their pre-existing conditions. So, for example, if they have asthma, for example, then our respiratory consultant can help optimize that. In addition to that, help provide some simple solutions to some of the long COVID problems, such as prescribing certain medications, such as nasal sprays if they've got a blocked nose, melatonin if they have sleep disturbances, traditional medications for headaches, caffeine shampoo for hair loss, things like that. Next slide, please. Now, from our point of view in therapies, what we do is we help promote education, awareness, and we help provide our clients with self-help tools. And one of the self-help tools that we provide our clients is access to the Living With app. And the Living With app is a one-stop kind of education resource for long COVID. So as you can see there are certain treatment programs that the patient or the client can engage in regards to their long COVID symptoms. As well as that, there's a library of information that they can access and find out more about their symptoms and discover helpful tips and hints to manage their condition. Next slide, please. And from the Living With app, we can monitor our clients through a number of outcome measures that are available on there. There's actually 11 outcome measures that are available on the Living With app, measuring different aspects of long COVID. As we heard earlier, long COVID is quite complex and there are many symptoms. But in terms of the respiratory outcome measures, there are the Dyspnea 12 and the MRC that's available on the app. Next slide, please. In addition to the outcome measures that are available on the app, we do also use a couple of other outcome measures that I believe Sarafat mentioned earlier. So the BPD questionnaire that you participated in earlier, although we've adapted that questionnaire and added a few more questions to, I think we've got about 14 questions to help our clients identify whether they do have a breathing disorder. And we also do a breath hold score as well. So we measure their breath hold score. And again, as the girls alluded to earlier, 30 seconds is an ideal breath hold score, and anything less than that requires attention. Next slide, please. So as I mentioned, our role in therapies is to help educate our clients, to provide awareness and support along the way. We provide a 10-week educational program in addition to the Living With app support. We also give our clients an opportunity to access peer support and to access support from a multi-professional team. And we also provide guided relaxation and meditation at the end of each session as well. Next slide, please. The main aim of our input is to help our clients, guide them through the grief cycle towards acceptance, where when we meet our clients, a lot of them will be earlier in the grief cycle. Many of them will be in the anger stage or bargaining stage or depression stage, and we help guide them through that towards acceptance and towards taking ownership of their condition. And as the quote you can see from the quote here by a famous author, understanding is the first step to acceptance, and only with acceptance can there be recovery. So we walk alongside our clients and we provide support, tips, advice, guidance, and we help signpost them to further helpful resources. Next slide, please. Next slide, please. Okay, so I'm going to go on to the role of physiotherapy in breathing dysfunction now. Next slide, please. So just to give you perspective, as I said, I used to work in acute care and I worked with acute COVID. And for me, that was a lot more understandable, because when clients come into acute care, they have an acute respiratory condition. You can see it on their x-rays, you can see it in their saturation, you can see it in their lung function tests, for example, their ABGs. So everything's deranged. And therefore, the breathlessness, the increased work of breathing and the limitations in their function make sense. What we have learnt after some time is that with long COVID, patients do have a good capacity to recover in terms of their chest x-rays. They become clearer, the CT scans become clear, their SATs return to normal, and the lung function tests are generally normal as well. And there's no indication for oxygen therapy. Yet these group of clients do report similar breathlessness, display similar work of breathing and limitations in their mobility and function. And for me, the question was, why? Why is this the case? Next slide. So I know Melissa went through some of the theories. So I'm just going to briefly go through it again. So one of the theories as to why long COVID clients experience breathlessness is an altered autonomic nervous system. So for some reason, COVID has changed the autonomic nervous system, where they are perpetually in a fight or flight phase, and therefore their breathing is heightened, and also their heart rate and their mood also is in that perpetual state of fight or flight. So this theory kind of helps explain some of the many symptoms that our clients do experience. So there's an alteration, there's a affinity to the sympathetic dominance, and it's difficult for patients to revert back to the rest and digest state. Next slide, please. Another theory, again, I think Melissa mentioned this as well, is that during the acute phase of COVID, clients often have to breathe heavily, have to try and get more oxygen in. And at the same time, they're also expelling a lot of CO2 out. And over time, by expelling excessive CO2, they become accustomed to a lower CO2 level, so the new normal. And as the acute COVID phase is passed, clients are unable to return to a normal CO2 level. They become intolerant of the normal CO2 level, and therefore their body keeps telling them to keep breathing hard and fast in order to keep the CO2 level at a lower level. Next slide, please. Again, as Melissa and Serafat mentioned, breathing dysfunction is quite complex, and it's not just about oxygen and CO2. We can see from this slide that even when the acute COVID illness has gone, there are a variety of other things that can, combine to keep patients in this perpetual state of breathlessness. And some of these things include weakness and pain, perhaps maybe because of the acute illness, maybe a sense of loss, perhaps loss of family members, loss of friends, or loss of identity. There could be work pressures, financial pressures, family and social pressures, and not being able to return to work, not being able to support family, and mental health problems as well. All of these combine together to make breathing dysfunction continue. Next slide, please. So our management approach is, I can summarize it in kind of two different sort of phases, or two different components. So both go hand in hand. The first one is to incorporate mindfulness, meditation, rest, relaxation. And I think this is important to help solve that fight or flight response, to help reduce that and bring the patient back to a more restful state. And so therefore, that's why we do a lot of relaxation, a lot of meditation, and we encourage patients to rest regularly throughout the day, having short naps, taking regular breaks, and to pace themselves. And this will help restore that fight or flight response. And when I went on a training course for breathing dysfunction, this was what the educator said to me, and it's really struck me, is that you can't do breathing exercises alone. You have to incorporate rest, relaxation, mindfulness, and meditation. So that's a key component to our management approach, and we're lucky enough to have psychology involved in our team as well. The other aspect in managing breathing dysfunction is breathing restoration, and breathing restoration not only involves breathing exercises, but a couple of other things as well, which I'll talk about now. Next slide, please. So the key principles to breathing restoration, as far as I'm concerned, and these are the sort of things that I've had to learn over the last few months of me working within the team, is that it's very important to promote breathing through the nose. And I've put a link down the bottom there to the importance of nose breathing. And I'll just mention a few. Obviously, many of us know the importance of nose breathing. Breathing through the nose is more hygienic, and it's more beneficial in terms of eating, drinking, communication, as well as humidifying the air and purifying the air. In addition to that, nose breathing helps to promote nitric oxide production, which is also anti-inflammatory, antibacterial, antifungal. So we try and promote nose breathing as much as possible. And if patients can't breathe through their nose, then we then intervene by providing other forms of exercise or advice. So, for example, if they have a blocked nose, we then go through some exercise that may help unblock their nose. These exercises include things like humming, nodding, singing, as well as nasal sprays and so forth to help unblock the nose, and also yoga breaths as well. The second thing that we encourage our clients to do is to measure their breath hold regularly. And again, Sarafat and Melissa went through this already. Your ability to hold your breath is a good indicator of your respiratory health, and 30 seconds is a good time. But it's important for our clients to know their breath hold score and to use that breath hold score for the next part, which is the breathing exercises. And so we go through a progressive breathing exercise plan with our patient. So I've left links there for you if you want to explore further about those three key components. But I'll move on to the breathing exercises now. Next slide, please. So the progressive breathing exercise is based on the Bitenko breathing technique. And I've left a link there down the bottom to a chap called Patrick McKeown who explains this very well. And it's broken down to 3 stages based on your breath hold score. So if your breath hold score is less than 10 seconds, what we encourage our patients to do is to do a series of nose pinching or to hold their breath. So if you're not very good at holding your breath, then the first stage is to practice holding your breath. And what this does is that it helps you to become more tolerant of CO2 buildup. Because as I mentioned, one of the theories behind why our clients experience breathlessness is intolerant to normal CO2. So by holding your breath, you are encouraging a tolerance to normal CO2. So we get our clients to do some breath holding. So if your breath hold score is 10 seconds, what we tell our clients to do is hold your breath for half the time, so 5 seconds. And then when you feel uncomfortable, to let go, have a break for 10 to 15 seconds and do that again. And you would do that repeatedly for 1 to 3 minutes. And you would do that very regularly. So what I encourage my patients to do is to do it every hour if they can. Okay, so that's the nose stage. The next stage of breathing exercise is called the slow stage. And this is for those clients who are able to hold their breath between 10 and 20 seconds. And within this stage, what we encourage our clients to do is to slow down the flow of their breathing. So we encourage our clients to put a finger underneath their nose, feel the flow of air onto their finger, and try and slow down that flow for as long as they feel comfortable, then to let go, have a rest, 10 to 15 seconds, and to go back and do that again. And at this stage of exercise, you do it for a little bit longer, so about 10 to 20 minutes, but you do it less often. So rather than every hour, you do it every couple of hours. The final stage of the breathing exercises is for those who are able to hold their breath for between 20 to 30 seconds. And at this stage, we encourage, the aim is to slow down the rate of breathing now, so to reduce the rate of breathing. So as Melissa and Sarafat referred to or mentioned, that a lot of our patients overbreathe and they breathe very, very rapid and very high. And so at this stage, the idea is to slow down the rate back to a normal respiratory rate. And this is and we encourage this by doing abdominal breathing or belly breathing, and focusing on extending the expiratory time so that you revert back to a 1:2 ratio of breathing. So one for inspiration and 2 for expiration. And again, our clients would be encouraged to practice this for a little bit longer, so 20 to 30 minutes at a time, but to do it every 3 to 4 hours. So as you can see, as the breath hold score improves, they move on to slightly longer exercises, but they do it less frequently. Each stage of the exercise, though, aims to restore that CO2 tolerance. Next slide, please. So before I move on to this slide, I just wanted to kind of compare the difference between breathing exercises that traditionally is used in acute care or with chronic lung conditions. So in acute care, the aim of breathing exercises is more to do with like getting more air in, increasing volume, increasing oxygen intake, improving lung expansion, opening up alveoli and things like that. In the long COVID subgroup, it's not that important to get bigger lung volumes. Actually, it's the opposite. It's trying to slow everything down, to slow the rate down, to slow the breathing down, smaller volumes, more diaphragmatic control, less accessory muscle use, less over breathing, back towards normal relaxed breathing. So that's the main difference, and that's something that I had to learn. Moving on to the last slide, what we do at the end of our program, as I mentioned, is signposting and referrals onwards. So we do refer our patients to a variety of different things. I've put a few things up here. They include things like exercise on referral, so exercise in the gym, yoga, Pilates, Tai Chi, walking groups, but specifically for breathing, we do refer our patients to things like online singing groups. And one of the online singing groups that we refer our clients to is ENO Breathe, which stands for English National Opera, and it's online singing to help improve breathing control. And so that's kind of a summary of what we do. Obviously, we do manage other conditions as well on top of breathing dysfunction, but this is in summary what we do for breathing. So thank you very much. And if there's any questions, happy to take them. Thank you. Back to you, Joanna.
Thank you so much. Does anyone have any questions for any of our speakers? I don't think there are any questions. Thank you so much to all three of you that have spoken today. What I'll do is I will, if you're all happy for me to share the slides, I'll email the slides around to everybody with a feedback form as well, and you can request a certificate of attendance if you'd like one. Yeah, there's a thank you in the chat from Joy. Yeah, so if there are no questions, we'll close the meeting. And thank you so much.
Thank you very much.
Everyone. Thank you.
Bye, everyone.
Bye.